So we're going to talk a little bit more about bonding and veneers. Bondings are the common term that we use to describe composite resins. Those are dental materials that are used to stick to your teeth. They are excellent for small fillings because they can mimic a tooth structure and they are able to bond adhesively to your tooth so we don't have to remove as much. Veneers, on the other hand, are slightly different. When we talk about veneers, what we are mainly talking about are porcelain veneers. Those are thin shells of enamel that are layered over your tooth and adhesively bonded into place. So that is fabricated in a lab and it is bonded to your tooth on top of what you have currently. The advantage of doing porcelain veneers is that the material is a lot harder, is a lot stronger, and is much more resistant to staining and chipping. For this reason, porcelain veneers are best when we need to cover a large amount of tooth surface. For example, if we want to restore a large chip, or if we want to cover the entire tooth to change the way it looks, to change the shape, or to change the color. Bondings or composite resins are better suited for smaller restorations because they don't have the strength of porcelain veneers in large sections.